Okay, so welcome back everyone. Here in this video we'll be discussing about the myotonic dystrophy. So what is myotonic dystrophy? So this is actually a type of muscular dystrophy, a group of genetic disorders that cause progressive muscle loss and weakness. So this is actually a type of muscular dystrophy. This mostly occurs in adults, and we have seen that there is actually a group of genetic disorders which causes progressive muscle loss and weakness. So we'll be discussing about this muscle loss. So people with myotonic dystrophy, these have prolonged muscle contraction, that is called as the myotonia. Now this means that if the muscle is contracted, then relaxation doesn't occur properly. Okay, so what is the pathophysiology here? So we are comparing two things. First is the myotonic dystrophy, and the second one is the Duchenne's muscular dystrophy. So in myotonic dystrophy, always remember that there is alteration in the protein synthesis. So the protein synthesis is altered, whereas in the Duchenne's muscular dystrophy, there is no dystrophin expression and mRNA degradation. Now, whereas the genetic changes are concerned in myotonic dystrophies, what happens here is that there are certain DMPK gene or CNBP genes. There is actually mutation here in this gene which causes myotonic dystrophy. So now we'll be discussing about the signs here. So what signs are seen? The first sign is that whenever we percuss the thumb sharply moves in the opposite direction and in adduction on percussion of the thenar muscles. So like we can see here, as soon as this examiner is percussing on the thumb is moving in adduction and opposite direction. Okay, so these are the muscle activities which are increased, we can see here in the graph. And apart from this, if we see all the like clinical features, there is also difficulty in releasing the grasp. That means ki once it is contracted, then relaxation is difficult. Now we'll be discussing about what are the different features. So the features which we see here is the frontal balding. Okay, we can see the frontal balding in this patient, and also in the picture. Then there is cataracts, there is hatches, that is the it is atrophy of the temporalis muscle, and ptosis is seen, drooping of the mouth is seen, and then there is wasting of the sternocleidomastoid, gynecomastia is seen. Okay, so these are actually the weakening of the facial muscles. We can clearly see in this patient that there is weakening of the facial muscles. So this was all about the clinical features of myotonic dystrophy. And one more important feature here is about the frequent falls. So the patient experiences frequent falls, difficulty rising from a lying or a sitting position. There is trouble running and jumping. There is waddling gait, very important. The gait is waddling. Then walking on the toes, large calf muscles, muscle pain and stiffness, and learning disabilities. So these were all the clinical features. Now we'll come to the treatment part here. So what is the actually the treatment for myotonia is we give quinine, we give phenytoin, we give other anticonvulsant drugs. So these drugs are actually given so that this reduces the symptoms. Okay, this relaxes the muscles, this reduces the symptoms. So these were all about the myotonic dystrophy. So I hope that this video was useful. Okay, thanks for watching guys.